Hi guys, welcome back to another video. On my last video we talked about my breast reduction process, and on this video we're going to talk about recovery, what to expect, the things you'll need to buy in, well, you might want to buy them before, but things that these are the key things you'll need. At least for me, this is what I used that I feel like was beneficial in my recovery process. If you didn't see my last video, I will leave a little link for you to watch it before you watch this video. But if you want a little backstory, I'll make it quick. I've had bigger boobs my whole life. I wanted smaller breasts, so I decided to get a breast reduction with implants. But once I met up with my doctor, he advised me otherwise. And obviously, it's been 3 months. I'm very happy with my end product. I'm very happy with the fact that I didn't get implants. Will I want implants in the future? I don't know. I doubt it. I truly love the size of my breasts at this time. I literally, if you can tell, I don't even have to like wear a bra. I don't wear a bra these days unless I need to. That's a luxury I've been looking forward to forever. I'm gonna go over a few things that you'll need in the recovery process. Make sure you buy these things obviously prior to your surgery, so everything can go smoothly. The first thing I will recommend that you get is comfy pajamas. I also underestimated how much comfy things I would need, because obviously you won't have a lot of range of motion. You want to be able to unbutton things easily and put them back on. So I do highly recommend you get comfy pajamas. In the first few days, you will need someone to assist you in putting your clothes on, because there's so much movement you can possibly do. You literally have to move very slow. You have internal stitches, you have bandages. You just want to be very mindful. The next thing you want to buy, you want to get compression stockings. That is extremely important. You get compression stockings. Compression stockings are supposed to help you in the post-surgical process, where to make sure you don't get blood clots in your legs because you're not as active. And then the number one thing you have to do after surgery is walk for minutes here and there. They want you to be moving around and not staying stationary, even if you're in pain. So I highly recommend getting compression stockings. And honestly, I was walking in the streets with my compression stockings, and you'll see that other people highly recommend it too, and your doctor also recommends it. So please feel free to, ask questions and listen. So from a medical standpoint, if you feel like you need to understand the purpose behind compression stockings. Even though I'm a nurse, I'm not here to give you medical advice, so please talk to your doctor or talk to a medical professional who is going to be dealing with you in regards to your surgery. And I do recommend, if your surgeon has like a group on Facebook or whatever that they might have, because Dr. Crow do have a Facebook group for members who've had surgery or going to have surgery. They have to accept you into that group. I highly recommend something. Now, I will say you cannot digest every single thing you read and every single comment and every single picture. Just know that your experience will be different. It's okay to read things and take it into consideration, but you don't want to digest so much negativity onto what happened to this person, and then next thing you know, you're terrified and you don't get your surgery done. So I highly recommend just look into getting with people who already either been through it or is going through it. So post-surgery, your surgeon will give you a surgical bra, but I do recommend getting other surgical bras to help you with changing, because sometimes there might be blood on one of them, and I highly recommend something that's either black or beige only because if you're having excessive drainage. I did not have that. I only had that in the beginning because I think I accidentally hit my breast on a door. So anyways, I'll get into that. You're gonna have to wear a surgical bra for at least a month, but please refer to your surgeon. I still have my little dandy folder that they gave me. I still have it around, just because I wanted to make sure I stay like in the knowing when it comes to like my progress, what I should be doing at month 1, month 2, month 3, what to expect. So that's another thing. Surgical bras, get 1, get 2, get as much as you need to help you in your recovery process. The next thing I highly recommend is a comfortable pillow. I did not think too much into that either, so I do highly recommend getting a pillow. Either a body pillow or a neck pillow or something that's gonna help you, because I had to travel for for my surgery. So on my way back home, I was still fresh out of like surgery in the sense of it's only been 3 days. So I had to literally still like hold a pillow with all the movement. Everything hurts, you know, like the process of just being in the car, getting in the car, getting out of the car. It's a lot. So you want things that are supportive, in the sense of a pillow, something that's comfortable, so you can be able to, you know, either lay back on it, especially sleeping. You will be sleeping in an upright position for a very, very long time. Now, your doctor will let you know when you can sleep on your back, when you're fully able to sleep on your back. But you guys, I was so annoyed because it's uncomfortable to sleep like in a sitting position. It's weird. Some people sleep in recliners. I was still sleeping in my bed, except I had to sleep in the upward position, which was, I did that I think for almost a month. The other thing I highly recommend is like gauze, like sterile gauze, and also silicone scar treatment or tape. I had a small keloid, and I read about keloids, but I never thought my skin keloid, but it does, and I have a small keloid on my left, on the right side. It's not big, but my scars are a little bit darker, obviously because of the melanin in my skin. So I do highly recommend you get on your scar treatment early, once all your stuff is healed, because you have to make sure all your incision is fully healed before you can use scar treatment. But I highly recommend, you know, getting in touch with your surgeon's office to find out what's the best scar treatment. The physician assistant that works with my surgeon recommended Scar Away, and I've been using Scar Away. I'm not sure if it's that effective, so I think I might have to like figure something else out, because my scars are still, they don't, it's not like I hate my scars. Obviously nobody likes scars, but I would like to make them a little bit lighter to match my skin tone. So I think I'm gonna look into, you know, figuring out the best way to just get them to look more, you know, decent. You also need to buy is that's something you have to buy in advance. Arnica helps with bruising. The doctors do recommend it. It helps with bruising. Now, will you have bruising? Yes. Will Arnica take away your bruising? Not necessarily. It's just more of a prevention method. So I highly recommend, you know, you talk to your doctor in regards to Arnica. And I think with Arnica, they have it on Amazon, and they even have it at like Walgreens or CVS or wherever you might live. But I bought mine on Amazon, which was easier to find. Now there are Arnica, I think, tea, there's Arnica pills, there's Arnica cream. You choose whatever works best for you. I had chose to buy the Arnica pills, which was reasonable, honestly. I didn't really have much complaint. There was not much like side effects to them when I took them, so I would recommend them. So I highly recommend just getting something that to prevent bruising. In the recovery process, I will recommend that you be patient with yourself, but everything feels like it's forever away, or it's gonna take forever to heal. And then complications, just expect that might even happen to you. For me, I accidentally hit my breast on a door. Now, I don't know if this is the cause, but I end up getting a blister in my left nipple. You guys, that was horrible. I did not expect that to happen, but I did consult the doctor's office, the surgeon's office, and then they obviously, initially, they weren't doing much now. So I know when things don't look right. So I think I was a little bit more forceful. Initially, I just, you know, wrote, because they have like an app, you can talk to them. And I initially wrote that, hey, I have this thing on my breast. I sent pictures so I can get, you know, an advice how to proceed. And I feel like the response was a bit delayed. So then I was being more, you know, direct. And eventually they put me on this like ointment to moisturize my nipples. And that's another thing you'll need is like Aquaphor. You need to moisturize your nipples because obviously your nipples are stitched and moved, so you don't want them to get dried and then to just get all, you know, weird. So I did get a blister in my breast, and then I had to use this antibiotic ointment. I think it's called, I forgot the name, Muro something. I have to look for it, I don't remember. And then I had to use an ointment. But obviously if you happen to have a complication like that, I'll add pictures if it's not too graphic, then you will need like a breast massager. So I will add a little clip of what it looks like. I got it on Amazon. If you happen to be prone to get keloids or you have buildup of scar tissue, on my right breast is perfect. My left breast obviously has, you know, some scar tissue that I consistently have to add warm compress and massage my breast. But I highly recommend, the minute you start to feel that, you get on it earlier on, because it only gets worse, it only gets harder to, you know, have them dissolve over time. Get everything in advance and prepare yourself if you happen to need it. The breast massage equipment, I don't think you need to buy it until if you feel like you need it. Some people go through this process easy peasy, and other people have you know, complications, so it all depends. So whatever works best for you, you do that. Part of this video we're going to talk about is what can you do within a certain time frame. Now this is strictly coming from personal experience and also what my doctor recommended me to do. So always, like I said, once again, I have to keep saying this because people take things the wrong way and run with it. So I'm gonna tell you, please consult your surgeon, your doctor, if you have further questions. But these are the things that my doctor educated me on and that I'm sharing with you guys. All right, so most people want to know, when can I lift things? As per my surgeon, after 3 months you can lift about 10 pounds. And for me, when it came to exercise, I slowly, initially I was walking, and eventually by month 2 I was doing my Peloton. That was more like lower body, and I was being very mindful how much, you know, force I was, you know, putting on the bike, is because I needed to work out. And another thing I highly recommend is, if you need to lose weight, if you need to get in shape, do that before, because the recovery process, there's not a lot of exercise involved. So the most you can do that's going to help you is walk, and then you kind of really have to be patient with yourself to wait until you're in the clear to be able to do full-blown exercises. And the other thing is, when can I take aspirin or Motrin? You can take those medications after 2 months. Once again, refer to your doctor. Obviously, there's a reason why they don't want you to take those medications prior, because obviously they can increase your risk for bleeding. Another question people might have is, when can I drink alcohol? Well, you can usually drink alcohol about 2 weeks after. I don't know what it is for smoking. If you smoke cigarettes, I don't know what it is in the sense of like when you can smoke cigarettes. Now let's just say you smoke other things, please ask your doctor. I don't know when is the best time frame. I do know smoking affects healing, so please feel free to refer to, you know, anything that your doctor tells you to do. This question is, when can you drive? You can drive a week after. That's what they say you can do. I don't know if that's fully true, because I did try to drive a week after and it was not comfortable, because all the movement with the wheel, all of this is like a lot of movement you have to do. So my doctor said you can drive after a week, but I say do what makes you feel comfortable. If you're uncomfortable with it, then don't do it. Just don't do it. Just listen to your body and listen to what your body is telling you in order for you to be able to know, okay, what can I do and what can I not do? Another question people have is, how long do I have to wear my sports bra or my surgical bra? You should be wearing your sports bra for about a month. Now, after a month, you should be able to wear other bras, but they don't recommend wearing anything with wires because it's gonna press on your scars. So you wanna be able to like wear things that are more comfortable, breathable, so you're not causing, you know, friction or issues to the site where you're still healing. I told you guys in the last video I wasn't gonna tell you guys what my size was. I think prior to my surgery I was wearing an F. I think maybe a 38F. I don't know, but like I said before, I was wearing the wrong bra size because I was in denial. But whatever, do what works for you. But now I wear a 38C. I think I measured myself the other day. I wear a 38C, and I think equivalent is a 36, 38 double D, I think. I'm still figuring out this whole situation with my breast size. For so long I was in denial. I never checked because I didn't want to know, and it's best to not know if it's gonna bother you. So I choose not to know. I knew, but I choose to ignore. So If you have a specific size in mind, keep that in mind, but just know your surgeon will pretty much direct you in whatever fits best for your body type. Anyways, guys, so I think this is pretty much it for this video. I think I tried my best to cover everything. In the case that I didn't cover something, or you have questions or comments, please leave them down below, and I'll happily get back to any of you guys who might have questions about this. And if you're thinking about getting breast surgery or getting breast implants, I highly recommend you do your research. I highly recommend you find a great surgeon. I highly recommend you educate yourself. For me, I kind of winged it a bit. I did not want too much naysayers. I didn't want too much negativity, because I wanted to keep my eyes on the prize, which is what I want and what I'm going to look like. And if you're, considering getting a breast reduction or breast implants, because I think it's something you're doing for yourself and you're gonna be happy with the end product. So do what works best for you. I always say I'm gonna do what works for me. What works for Rose is what we're gonna do for Rose. I would love to create more, useful content for you guys. I do believe, I'm trying my best to be authentic, because that's why it took me so long to shoot videos, because I was like, I want to be authentic. I want to provide people with videos that are helpful to them. So I feel like this was a pretty helpful video. Once again, I always want to thank you guys for watching, for commenting, for subscribing. If you like this video, don't forget to comment, like, and subscribe, and I will see you guys in another video. Alrighty guys, bye.